They're the first to hit the ground in the morning and the last to rest at night. And as important as they are, most of us barely give our feet a second thought.
But for some, though, those 10 toes can reveal much more about your health, especially for those with diabetes. DelmarvaLife's James McDonald visited Thomas Podiatry to learn the simple steps you can take now to keep your feet healthy for years to come.
At Thomas Podiatry, the goal is simple: keep patients' feet healthy. For Dr. Japar, that often means helping them catch problems before they turn serious.
I wanted to focus more on helping the population that needs the most help, diabetic-prone population. That way I can do my contribution to help them, educate them, make them feel better, and probably save some limbs.
The passion of her work goes back to her time studying nutritional science.
With those patients, I saw a lot of people get amputations because they weren't aware of the risk of diabetes. So I wanted to be a part to prevent amputations, educate patients for long term to benefit them.
She says most people don't think about their feet until something goes wrong.
They are more likely to have poor circulation and nerve damage. With poor circulation, the arteries become very narrowed and hardened. That would cause a delay in wound healing. With nerve damage, people don't have the ability to feel pain as normal people do. So the ulcers and wounds can go unnoticed until they become infected.
Dr. Thomas adds that feet often reveal the earliest signs of diabetes.
People that are diabetic, oftentimes the first problems associated with it start in the lower extremity, the feet, the ankles, etc. So people can start having different sensations such as neuropathy can start in the feet, decreased sensation. Also, poor circulation tends to start in the feet and manifest throughout the rest of the body.
He stresses the importance of daily foot checks.
Daily foot checks is very, very important. So we want to make sure that we don't have any open sores, no cuts, no scratches. We want to make sure the skin is soft, healthy, viable.
Dr. Japar sees about 50 diabetic patients a week, many with preventative problems.
If they don't get this treated quickly and properly, even a small blister can become infectious, and this might lead to hospitalizations, even amputations. So early treatment and care is very important.
Sometimes prevention is as simple as wearing the right shoes.
When you wear good shoes, it will change your life tremendously, especially for people who are on their feet all day, who have to stand all day. Your feet have to be supported well.
Dr. Thomas says the kind of care patients receive is what makes his practice stand out.
We're just a one-stop shop. We can do everything from palliative foot care, trim and nails calluses, to advanced corrective surgery.
For Dr. Japar, having everything under one roof means she can treat the full picture.
Here we have comprehensive care. We have access to x-rays if needed immediately. We have access to wound care, infections. We also go to the hospital, so we have access to provide comprehensive care for the patients, not just to treat their infection, but also to address their biomechanics, do surgeries to correct if anything needed correction.
Dr. Thomas and Dr. Japar say it's important to get your feet checked by a professional the moment you notice symptoms.
Just pay attention to your feet. If you have any doubts about your health concern, how it looks, even just you want to get your feet checked to make sure everything is okay, just call us and we are available and we'll be able to help you.
Because at Thomas Podiatry, the team is there with you every step of the way towards healthier, stronger feet.
Dr. Japar tells us her favorite part of her job is seeing the reactions of patients when they walk out of the office pain-free. To learn more information and schedule your appointment, visit our website and click on What's Happening Today. You know, your feet are so crucial to your well-being.
Absolutely.
I mean, if you can't get around,
right,
and it sounds like they can solve all those issues. So.
Well, both Bob and I have been treated at Thomas Podiatry, and we have been very pleased because we're both runners. So we want to get back on our feet as soon as possible.
Yes, you do want to get back on your feet, and they can make that happen.
Yes.